So good evening, everyone. Welcome to part 1 of 2 of our provider status webinars. I am Lauren Kirk, your APhA-ASP Speaker of the House. I want to welcome you all to this webinar. It's been one of the most highly anticipated and at this point one of the most registered for students. So we're excited to have quite a large audience join us for our provider status webinar. We have APhA's Government Affairs team here to really help us learn about APhA's Pharmacists Provide Care campaign and prepare us as student pharmacists as we look to attend SLI as well as go to the Hill. And we'll also look to prepare other student members and new practitioners to discuss provider status to anyone that may ask questions or really want to hear about our initiatives. So before we get too deep into the webinar here, we'll go ahead and go over some webinar procedures. So you'll see the audio mode menu screen there to your left, and if you want to use the telephone, that is oftentimes easier. You'll click Use Telephone, dial that phone number, and provide the access code when prompted. If you want to use your computer, you can use the mic and speakers by clicking that option. And for all of our attendees tonight, we'll ask you to please mute yourself in order to make sure that there's no feedback or interference with those presenters that are speaking or those individuals that are asking questions. So we'll be following along as our two presenters tonight on the display screen there. We'll have the opportunity to ask our presenters questions, and that can be done by writing a question into the question section or the question panel there. It will be sent in to staff that are helping us this evening go through our webinar, and we'll collate those and answer them at the end of the call. It is encouraged, though, that you do not wait until the end of the call to submit your questions. So when you do have a question, go ahead and submit it. We will make sure we get to it by the end of the call. So before we get to, after all of our webinar procedures, we want to see who's in the audience tonight. So we'll start a poll here. We have one of 4 options. So who's in our audience tonight? Are you a student pharmacist member? Are you a student pharmacist member attending the APhA-ASP SLI? Are you a new practitioner member, or are you a pharmacist member? So we'll go ahead and open the poll and get everyone started. So we'll give it about 5 more seconds on the poll. And closing the poll here. All right, and it looks like our poll results indicate 58% of our audience tonight are student pharmacist members attending APhA-ASP SLI. Our second most popular option are the student pharmacist members at 29%. With a few new practitioners, welcome to those new practitioners, and our 1% of pharmacist members. So we're glad that our new practitioners are here, and we're glad our pharmacists are here as well. So our webinar presenters, now that we know who's in our audience, we'll go ahead and learn who exactly will be presenting to us tonight. We'll welcome Michael Spira, Senior Lobbyist for APhA, and Lauren Deputer, the Senior Manager of Grassroots Advocacy and Political Action Committee. So, Michael, we'll go ahead and open the mic for you to introduce yourselves to our audience here.
Thank you, Lauren. My name is Michael Spira. Like Lauren said, I'm a Senior Lobbyist here at APhA. I've been with APhA for 3 years. Prior to joining APhA, I worked on Capitol Hill for 10 years, where I served for the last 3 years as the Chief of Staff for a member of Congress from New York.
Very good. And Lauren?
Hi, everyone. I've been with APhA for a little over a year now. I manage the Grassroots Advocacy and the Political Action Committee. Before I was here, I was with another physician association where I managed their PAC and did some lobbying for them. I was there for about 3 years, and before that, I did fundraising on Capitol Hill for congressional campaigns for about 4 years.
Well, we have quite a credible group joining us from APHA's Government Affairs team. We're happy that you're here and really want to remind our student pharmacist members and anyone in the audience that these individuals are excellent professionals and they are definitely a resource for provider status and APHA's Pharmacists Provide Care campaign. So if you have any questions after the webinar, we'll review their contact information towards the end of the call, and we encourage you to speak to those individuals at SLI or email them your questions. But for now, I'll turn it over to Michael and lead us through provider status. Michael?
Thank you, Lauren. So to give you an idea of where we'll be headed this evening for the webinar, I'm going to give a background on provider status, why we need it, what it entails, talk a bit about the legislation and where we're headed from there. So as you see, we're going to begin with a debate for provider status. I apologize. There we go. Oops. So as you all know better than I, APHA has begun this campaign to achieve provider status to recognize pharmacists as valued members of the healthcare team. This has been an issue that pharmacists have been trying to achieve for decades. And pharmacists are one of the few healthcare professionals that are not recognized as providers under federal law. Midwives, dietitians, chiropractors, nurse practitioners are all recognized, and rightfully so, as healthcare professionals under Medicare laws, but pharmacists are not, which is why APHA has embarked on this campaign to achieve provider status. The problem why APHA has begun this undertaking is because you look at healthcare in our country. Healthcare spending in the United States is expected to reach almost $5 trillion by 2021. That's up from 2.6 in 2010 and 75 billion in 1970. So that's a big jump, and it will account for nearly 20% of our GDP, or 1/5 of our economy, by 2021. And the U.S., the United States, spends almost $300 billion annually on medication problems, including medication non-adherence. And chronic diseases cost our nation almost $1.7 trillion annually. And that's more than 75% of healthcare spending. We look at the population. People 65% and older represent over 13% of the population in the year 2010. But as we all know, our population is getting older, and that age bracket, the 65 plus, is going to be over 19% by 2030. Currently, nearly 70% of Americans are at least on one prescription drug, and more than 50% take two. 2011, there were nearly 4 billion prescriptions filled at U.S. outpatient pharmacies, an average of more than 12 prescriptions per person. And almost 50% of these people prescribed medications for chronic diseases do not take their medications correctly, and we know that is a big problem for our communities and for the patients especially. And when pharmacists are involved, patients across the nation receive better care, and there are better outcomes because of pharmacist quality patient care services. And some examples are coordination of medications during care transitions, comprehensive medication reviews and monitoring, chronic disease prevention and management, and wellness services and education. As you all know, 58% of you are coming for SLI, 29% are students, and we have 1% that's pharmacist member, and then we of course have some that have recently graduated. And you are all, regardless of which of those four you fit in, are highly educated with more medication education and training than any other healthcare professional. Very important that you realize that. You have more training on medication education and training than any other healthcare professional. And as you know, pharmacists today are required to have at least 2 years of pre-professional study, followed by 4 academic years of professional study, leading to the PharmD degree. Student pharmacists receive education and training alongside other healthcare professions. Patient access to Pharmacist Care Coalition activities. A little background on this for you. So what this is APhA is part of a broad coalition of pharmacy organizations united in promoting patient access and coverage to pharmacist patient care services. The goals of the coalition is to seek consumer patient access and coverage for pharmacist patient care services, to payers and policymakers who recognize pharmacists as healthcare providers, and inclusion of pharmacists as members of patient healthcare teams. The Patient Access to Pharmacist Care Coalition, we're all united in support of our federal legislative ask, which I'll get to momentarily. This organization, the APhA-ASP, if you will, was publicly announced in early March 2014, and the organization, the coalition, has more than 20 organizations, and it's growing. And the coalition represents patients, pharmacists, pharmacies, as well as other interested stakeholders. So it's a very unified coalition and unified ask. And you'll see here the different member organizations. And like I just said, it is growing. But you see everyone, like we're APhA, NACDS, NCPA, ASHP, AACP, and a bunch of other organizations are working to achieve recognition for pharmacist services. The legislation, HR 4190. Hopefully this is not the first time you're hearing about the legislation, but I'd like to spend some time talking about it. So HR 4190 was introduced on March 11th by Congressman Brett Guthrie of Kentucky, G.K. Butterfield of North Carolina, and Todd Young of Indiana. The legislation would amend Section 1861 of the Social Security Act to recognize pharmacist services in Medicare Part B. Pharmacist services would be covered and paid for under Medicare Part B if they are provided in medically underserved communities. So that's the important part there, is Medicare Part B. So who can do it? The pharmacists that are state licensed pharmacists with a BS Pharm or PharmD degree who may have additional training and certification depending on state law. The services are services under state scope of practice. So it is allowed in the state. Those are the services that pharmacists would be reimbursed for. And the patients are medically underserved areas, medically underserved populations, or HPSA, which is the health professional shortage areas. And all these three things, the MUA, the medically underserved area, MUT, medically underserved population, and HPSA, the health professional shortage areas, are things that are defined by HRSA, the Health Resources and Services Administration, which is in HHS. So, let me kick it back over to Lauren. We have another poll question here.
Thank you, Michael. So our poll question, how many co-sponsors do we currently have for HR 4190? Our options are 12, 21, 39, 56, and 87. So we'll open up the poll here. Keith, is the poll open? I have my screen says that it's stuck on the other poll. Here we go. There we go. Now we'll open the poll for how many co-sponsors do we have for HR 4190? And we'll give it 5 more seconds on the poll. And final submissions on the poll. And let's see our results. So our most popular answer with 41% is 39 co-sponsors. Our second most popular answer is 39%, focusing on 21, with a few percentage points following in the other options. So, Michael, how many co-sponsors do we have for HR 4190?
Well, we currently have 39 co-sponsors, although I should say, I'm proud to say that we are now at 40 as of today. We are at 26 Democrats and 14 Republicans. So it is a growing number of co-sponsors. And as I said earlier, this is a united pharmacy effort. So when we go to Capitol Hill, it's not just APhA, it's APhA, NCPA, NACDS, ASHP, Walgreens. We're all going up together, meeting with these members of Congress to ask them to co-sponsor the legislation and lend their support to pharmacists within their communities so the pharmacist patients, the members' constituents, can have access to pharmacist services. But we do get some questions and we do get a little pushback. Some common questions we are asked is, what is the position of the American Medical Association? The doc groups, what are the physicians saying? And at this time, the AMA, the docs, neither oppose nor support the legislation. That is not to say that in the future they won't oppose the bill, but at this point they don't oppose nor support. I highly doubt we ever will receive their support on this bill. But we do have a physician member of Congress that has co-sponsored the legislation, and that is Congressman Rowe of Tennessee. So I would tend to think he would not co-sponsor the bill if he didn't support the bill. Another question we receive is the cost of the bill. How much would this cost the government? And there have been 2 independent studies that the coalition has done, and it would cost less than $1 billion a year over 10 years. So usually, Congressional Budget Office will score legislation, meaning how much does the bill cost to implement. And our bill, HR 4190, costs less than $1 billion a year. And we would work with members of Congress and within the Pharmacy Coalition to figure out a way to pay for that bill. At this point, we do not have a Senate bill. We hope to have a Senate bill introduced before the end of summer. We are working on that, and hopefully, possibly, maybe even when some of you come to Washington, D.C. for SLI. The future provider status, what could it provide, and what could it mean for pharmacists? Being recognized as healthcare providers would expand job opportunities and greater professional fulfillment, therefore strengthening the future of pharmacy for student pharmacists. It would also allow you to practice at the top of your license using the skills and training you have received and are receiving. The next steps, what do we hope to do with not just HR 4190, but provider status within the states? This goal is to keep pharmacy unified, and a big part of that is to grow and strengthen the coalition that was just formed earlier this year. To achieve legislative success in the current political and fiscal environment, we need to demonstrate, we being pharmacy, the profession, needs to demonstrate evidence of value. Independent evidence review. Maybe some of you have seen a study that APhA did on the value of pharmacist services. It's on our website, and I recommend that you take a look at it. We need to identify, build, and strengthen relationship with other healthcare stakeholders, policy makers, patients, and payers. We need to make sure that they understand and realize the value that the pharmacists bring to the healthcare team and the community. But most of all, the effort we need is your involvement, and being on this call is a huge step. Oops, apologize. As I mentioned earlier, we have a lot of information on our website. You can go to pharmacistprovidecare.com, which you see on the bottom the slide. You can also access this information through APHA's website. We have things like the information you see here. We also have background information on the legislation. So when you have a few minutes, you have not already, please take a look at it. Sign up to be a key contact where we can send you information and ask for your assistance in this campaign. I'm going to hand it off to Lauren Computer at this point.
Hi guys, as Michael was just saying, make sure that you sign up online through our website to be a provider status volunteer. We really do use that list to connect you to legislators, and we send out updates on a regular basis of what's going on or if we need you to do anything. We also have the email that goes up to your member of Congress that urges them to sign on to HR 4190. So I really hope you guys send that up there too. Also, make sure that you set up your Hill visit. When you're here for SLI, there's a link on our Legislative Action Center. All you have to do is edit the letter appropriately, and it'll go up. You fill out your address, and it'll go up to your legislator requesting the meeting. Or you can just go on the Contact Us section of your legislator's website and just shoot off an email saying that you want to meet with them to discuss HR 4190. These offices are really used to these requests, so don't be afraid to do that. We're also really trying to do a big push now that we have the legislation to get legislators to come visit schools. We just did it in the University of Florida a couple months ago. We had Gus Bilirakis come there to visit. So we're trying to do that, make it more of a widespread thing. And make sure that you donate to the PAC. I know you guys are students. I know it's hard, but every cent counts. The PAC really does help us educate members of Congress on the importance of HR 4190, and they really want to hear from students too. They want to hear how you're working in a healthcare team, how you're helping out your patients, and this PAC really helps us be able to do that. And at SLI, we're having a barbecue that night on the terrace, so you'll be able to support the PAC then. We'll be selling the cups and wolf kegs and other refreshments, so hopefully you'll be able to participate in that as well. And that's it for me.
So thank you, Michael and Lauren, for joining us. We have your contact information displayed here on the slide. As I mentioned before, both of these are stellar professionals that are working very hard for us on the Hill to represent pharmacists and student pharmacists in order to obtain provider status. And so if you have any questions for them, we can go into a Q&A at this point. And if your question isn't answered tonight, then you can definitely contact Michael and Lauren via their email addresses and phone numbers right there. So at this point, I think we'll pass it off to staff to lead us through a question and answer session in order to make sure we all have an understanding of what provider status is. Please feel free to submit your questions. So Keith, do we have any questions?
Yes, we do. Thank you, Lauren. So first question tonight, Michael, if you probably want to take this one, it's from Bethany Krebsky. She asks, how is a medically underserved population defined?
It's a very good question. So it's something that HHS looks at. It can be anything from lack of healthcare providers in the area. It could be, I mean, they look at, I'm not trying, how can I phrase this? It's really just a variety of things. It's probably very simple socioeconomic things, short healthcare professional shortage. So what they do is they take all these three things, the area of the population and the hips of the health professional shortage area, they take all those three things and they combine them into one to determine what's a medically underserved. And it's actually interesting if you can look at the map on HHS, on HRSA, and they'll show you medically underserved. And I recommend if you want to do that, it's pretty interesting to take a look. But those are the three areas. It's medically underserved area, medically underserved population, and health professional shortage area that this legislation focuses on.
Great. Thank you so much. The next couple questions are related to cost. And one of the questions from Nellie Jafari was, with Republicans' concern for cost, how can we go around the bill so that basically she's asking it doesn't save money in the short term, rather it saves money in the long term. So how do we kind of prove the value of pharmacist services kind of in the short term so we can kind of look at the long-term gain?
It's an excellent question, and we get that question asked a lot about the cost. Members of Congress and their staff say, oh, this is something we can't support because of the cost. And CBO, the Congressional Budget Office, what CBO does, unfortunately, is they don't look at what preventative measures can do to save this country money. They only look at they're very data-driven. They only look right in front of themselves. So we, being pharmacy, have to show that we can save money, and it's not as easy as it sounds because a lot of the information we have is our own. So we know, though, that when pharmacists are involved on the healthcare team, that we save money. We keep people out of hospitals. We keep people out of the doctor's offices, and this will save money on the long term. CBO has started to realize these types of things because CBO now does realize, the Congressional Budget Office, that when people take their medications, that it saves money. But we would like them to take a step further and say, oh, not only if they take their medications, but if they take their medications correctly. So it's all a question on how does CBO look at these things. And unfortunately, it's all static scoring. It's not dynamic scoring, meaning we know that pharmacists could save money keeping people out of hospitals, keeping people out of doctor's offices if pharmacists are involved in the healthcare team. So the cost is an issue that we are working on within the coalition. It's an issue that members of Congress understand, but a lot of members of Congress will co-sponsor the bill because they do realize the value that pharmacists bring. And we are getting more Republican support. The most recent co-sponsors, if you were to look it up, are all Republicans, because a lot of Republicans, too, and these are very conservative Republicans, realize that the value that a pharmacist can bring to the healthcare team. They understand that the pharmacist can save this country money by keeping people out of the hospital. So it's a question that we're dealing with internally. It's a question that members of Congress are dealing with. But at the same time, we must explain that pharmacists can do these things and control healthcare spending in our nation.
Great. Thank you very much. Our next question this evening is, you mentioned in one of your comments or on one of the slides that says, depending on state law. So Jay Sheath had asked, how many states already have provider status approved?
So it's sort of two questions in one there. So how many, the top of my head, I can't answer that question for you, but that's something we can get. How many states actually reimburse pharmacists for their services? What our bill does is the pharmacists that are working within these medically underserved communities would be reimbursed for services under state scope of practice. Each state has a certain amount of services that a pharmacist can perform, and they vary from state to state. No two states have the same state scope of practice. So if you live in one state but you work in the other state, you would follow the state that you work in. And if you don't work in a medically underserved community, you wouldn't be reimbursed. You must work within that medically underserved community to be reimbursed for the services. So like I said, each state is different. Some states, California passed a law the end of last year to expand state scope of practice. Other states are looking to do that. Massachusetts did something recently. Indiana, Wisconsin. So a lot of states are expanding the scope of practice for pharmacists, but you look at California, when they passed their bill, yes, they expanded the services that a pharmacist could provide, but they didn't have any payment mechanism in there. So our bill would allow pharmacists that work in a medically underserved community, and that's medically underserved area, medically underserved population, and a health professional shortage area, those that work within those communities that practice at the state scope of practice, under the state scope of practice, to be reimbursed for their services under Medicare Part B.
So a follow-up question to that from Paul Stolzak is, so the legislation provides, us with the opportunity, pharmacists the opportunity to kind of practice and receive compensation in those areas. How far out do you think we are from receiving it for all patients that we work with, not just the medically underserved?
It's a great question, Paul. We would love to have all pharmacists, all services, and that's our next step. That's our next goal. Right now, we've got to work in the political climate, political environment, fiscally, that we're working in. And there was a question earlier about the cost of the bill. If we were to do all pharmacists, all services, the cost of the bill, I said between $3 and $5 billion for this bill, at a zero, because it would just be all pharmacists, all services. So the goal is to have all pharmacists, all services somewhere down the line. But right now we got to work with what we are dealing with on Capitol Hill and what we're dealing with our economy. So the goal is all pharmacists, all services one day. But right now we're going to work with what we have. And I will say, going back to that medically underserved question, you'd be surprised how many communities are medically underserved. You may think you don't live in a medically underserved community, but you might. We had some meetings today with members of Congress, and their congressional district was 96% medically underserved. So you'd be surprised how large a medically underserved community can be. So although it's not all pharmacists, all services, a lot of pharmacists will be able to get reimbursed for their services through this legislation. A great question. Thank you.
The next question relates to more or less of looking at your crystal ball there again, Michael. Would it be beneficial for student pharmacists to start looking at positions in these areas if they're looking for future career growth?
It's a great question, and I would say let's get the ball moving on the legislation. Let's get 4190 across the finish line, because the bill's not going to pass tomorrow. It's not going to pass this year. What we're trying to do is get as many co-sponsors, as much support for the legislation this year, and this is the end of the 113th Congress. So after the election in November, January starts a new Congress, the 114th Congress. So we'll have to reintroduce the bill then, and then our goal for the 114th is to have a legislative hearing and maybe pass the bill in 2015 or 2016. This is a multi-year effort. So my point being is that you don't know where you'll be living. We don't know what the HRSA map I referenced earlier will look like for the medically underserved. So as of right now, our goal, let's get the legislation passed, let's get it moving along, and then we can reap the benefits of job opportunities and better patient care. But right now, let's try and get as much support for the bill as we can.
Great, thank you. One of your slides mentioned the American Medical Association not taking a position. And one of the questions, I'm going to kind of paraphrase from Aaron Pauling, is that the bill kind of implies that pharmacists benefit when other providers aren't able to fulfill the roles that they maybe do because they're in a medically underserved area. So what do you see as, how does this affect the pharmacist position or the role as part of the medical team or the healthcare team? Does it diminish our role? Does it help expand our role? Talk a little bit about that.
Sure. So this would just lend support to the role that pharmacists have on the healthcare team. We all know that pharmacists like to and enjoy working in a collaborative team environment and team effort. And the person's, let's say they live in a rural area and their position is 20 miles away, but their pharmacist is down the street. they can go to their pharmacist, and the pharmacist can help them with one of the services. Maybe they're managing their diabetes. They can get the physician on the phone. It's all about working collaboratively. And maybe there is a collaborative practice agreement between physician and pharmacists in certain, in the state and whatever they might be working on. We're not trying to take over the role of the physician. We're just trying to help those patients who don't have easy access to their physician or physicians in their state. We're not trying to expand our scope of practice. It's the scope of practice that is on the books within these states. We want to be part of the healthcare team, part of the solution, and not looking to step on any toes. And I want to go back to the beginning of this question about the AMA and non-opposition. And part of the reason is because of the HPSA, the Health Professional Shortage Area. Their physicians are not in these areas, or there are just a few of them. So it's hard for them being the physicians, the doc groups, what have you, oppose something when they're not there. So that's part of the other reason we haven't heard much pushback. Now, who's to know in the future? Who's to say that when we have a legislative hearing next year that they're not going to come out against it very strongly? But at this point, we have not received much pushback. They are aware of the bill, but as like the bill said, it's the HPSA. We're not looking to expand our scope of practice. The bill is state scope of practice, and it's all about working collaboratively for the patient, the benefit of the patient who might not have their physician in their town and they have to travel far. Pharmacists want to be part of the solution. So very good question. I appreciate it.
Thank you, Michael. Two questions, one from Scott Brewster and then the other one from No Lugo. Both kind of ask something similar. They talk about the PharmD and the BS degree, but they want to know, do you need additional residencies, classes, CE, any specific services, kind of like we do right now for the diabetes management or some of the other credentials that we have. But how will this be integrated into ongoing practice or continuing education? Do you need additional certification, that sort of thing? Say this passes.
That's an excellent question. No. You're licensed, you're good to go. As long as you're licensed in the state, you can practice to the full extent of that license. As long as you're practicing in a medically underserved community and you're following the state scope of practice, you would be reimbursed to Medicare Part B for your services.
So, Michael, can the state add more stringent guidelines to that?
As the bill is currently written, no. But if you look at the legislation, there are some things that CMS would need to work with us, but that is down the road. That is not something I want anybody to concern themselves with right now. Right now, it's you're licensed pharmacist, state scope of practice, in a medically underserved area. Those are our key points, and you get reimbursed for your services in Medicare Part B. The state boards of pharmacy, the state legislatures, they work with the healthcare community in their states to determine the state scope of practice. Each state varies for the scope of practice, and that are activities that state associations can work with their state legislatures, state boards of pharmacy to expand their scope of practice or work on that scope of practice.
Thank you. To shift gears a little bit, the next two questions talk a little bit about APHA's role in kind of getting this started and continuing the efforts here. Elizabeth Carter writes, and I'll read both of these for you, Michael, and you can answer them together. One pharmacist I'm working with is responsible for collecting patient stories for APHA to help demonstrate value. What role do students currently have, and what more can we do to help with this? That's from Elizabeth Carter. And then the second question from Nikki Patel says, besides talking to our state and federal legislators, what projects will APHA specifically create to impact our community and also help support pharmacists and student pharmacists to make a push for provider status?
Two great questions. Thank you, Elizabeth and Nikki. So being on this webinar right now is something you can do. You're educated, you're learning about provider status, you're learning about HR 4190, and this will be the first step in hopefully many steps that you take in working to secure reimbursement for your services. Other things, hopefully you'll be coming to SLI. If you can't come to SLI, maybe you can come to Washington, D.C. to meet with your representatives and their staff at a different time. Or, just as good, sometimes even better, if you can't get to D.C., meet with your representative and or their staff in their district office. As a former staffer, it was great having people come into D.C., but I always told them, make sure you meet with the healthcare staffer in the district office, form a relationship there. Invite your representatives, invite the staffers to your universities, to your place of business. Let them see firsthand the value that a pharmacist brings. Let them hear from you. That's something we can help, that Lauren and I can help you with. Everything and anything you can think of. When you guys are at annual meeting, you're always hearing us tell you to talk to your representatives, talk to your members of Congress. It's fine when members of the Pharmacy Coalition go up to Capitol Hill or out into the state. It's much, much better when you all do it, because you are pharmacists, you're student pharmacists, you're pharmacists. They want to hear from you. It's so great when you guys do that, and this webinar is one step of many to do that. SLI, meeting with people in the district office, and we can help you reach out and find out who your member of Congress is. We can help you meet the member of Congress in the district. A lot of different things. You want to do a fundraiser and get the member of Congress there. There are so many different things that you all can do, and you guys have the ability. Don't think you're a student that these members of Congress don't want to listen or meet with you. That's actually the extreme opposite. Members of Congress and their staff want to hear what students have to say, and they want to hear and see what you guys are doing and what you're learning. So please, if you have any interest in obtaining reimbursement for your services, please reach out to us and let us help you meet with your member of Congress or staff in their district, or have them come to your chapter, or whatever else you can think of. So hopefully that answers that question. I know, Keith, there were 2 in 1 there, so hopefully I answered that question.
I think you did a great job. It looks like one of the last questions that we have here, there are several that have been submitted. I'm going to forward those directly to Michael post-webinar so he can get a little bit more into the details with some of you guys. But one of the last questions here kind of relates to pharmacists and those who are in the coalition. The question says, in your opinion, will ACCP's stance on HR 4190 affect the ability for this to pass? And that was by Gabriella Cabanilla.
It's a great question, Gabriella. And as you saw on the list, ACCP is not a member of the coalition. And we are working with the members that are part of the coalition. We have over 20 members. ACCP they are on Capitol Hill meeting with members. They currently do not have a bill introduced. At this point, they are shopping their bill around, but nobody has picked it up. So we are working with those that are supporting HR 4190. We will continue to work with those that support HR 4190. And the 20 plus, it's growing all the time, members of the coalition that are working to support pharmacist services. 20 plus groups is a lot of groups, a lot of organizations, a lot of coalition members, a lot of associations, so on and so forth. And I'm very happy with the amount of members that we have as part of this coalition, and I look forward to working with them throughout this process to get this bill passed and across the finish line.
Great, thank you so much. It looks like it's the end of the questions that we have here this evening. We're going to turn that back over to Lauren in just 1 second, but I do want to thank everyone tonight, all of the new practitioners that joined us. Please, please, please contact Michael and Lauren via their email if you have further questions. and we'll try to do our best at APHA to provide as many resources as we can on pharmacist.com as well as the pharmacistprovidecare.com sites so that you have as much information as possible when you go out there and advocate for the profession and provider status. I do want to remind all of those student pharmacists that are coming to the Summer Leadership Institute. We will have the second portion of this webinar, which will be on July 16th. It's not going to be on the 15th. It was originally the 15th, but that's the same night as when all the Chapter Achievement Award reports are due. So it's going to be on July 16th, the same time at 9 o'clock. And that one is going to kind of cover the what to expect, what to think about as you're going up to the hill, how to get up to the hill, what to do during your actual hill visit. What are some of the things that you want to talk about, how to conduct maybe the hill visit more or less. So we'll spend some time talking about the nuts and bolts of the hill visit itself. And also we want to make sure that everybody completes the online form to let us know who you're going to be visiting with. So once you schedule your visit with the scheduler up on the hill, you got to let Lauren and Michael know. And we're trying to get all that information about a week and a half, hopefully, before the Summer Leadership Institute, so that our government affairs team can prepare you with a folder as well as information, leave behinds, one page or so on and so forth, so that you can provide those to the staff member that you meet with, so that you can have a good visit there. But thank you very much from APHA staff side of things, and turn it over to you, Lauren.
Thank you, Keith. Thank you for all those updates and for fielding the questions. We had quite an interesting pool there. And thank you, Michael and Lauren, for joining us and taking time out of your evening to join us and speak to us about provider status, as well as for all of your work on Capitol Hill, making sure that we have provider status as future pharmacists. So I think Keith covered all of our updates. I know I'll speak on behalf of the incoming or the current NEC that we are extremely excited to see everyone at SLI and meet all of those student pharmacists who aren't able to attend SLI at a future APHA meeting. So with that, thank you everyone for attending. We look forward to seeing you in the future. So we'll sign off for now, and we look forward to seeing you in the future.